Proning. It's one of the ways to relieve breathlessness in COVID-19 patients, and that's what we're going to talk about today. Hi guys, my name is John and welcome back to our healthcare series. So if you're new to this channel, I basically create videos about mathematics, healthcare and examination tips such as the IELTS and the OET. In this video, we're going to talk about proning, and this basically aims to help people who have tested positive for COVID-19, especially those who are experiencing breathlessness or difficulty breathing. Also, if you got family members or friends who have tested positive for COVID and you think they're struggling right now, this video will help them. So this video pretty much covers what proning is, and then we're going to touch some history, a little history, evidence, and benefits of proning. Also, we're going to talk about contraindications for proning, how long you should be proning, and how you're gonna do the proning. Let's start. So the first question, what is proning? So proning is a process of turning oneself or someone onto his stomach, belly, or tummy so that he will be lying face down. So basically, proning is the opposite of lying on your back, and it means that you're lying on your tummy with your chest and face down. So just a bit of history. Back in the 1970s, clinicians investigated the potential of patients on their stomachs to treat acute respiratory distress syndrome, or ARDS. The lung injury in COVID-19 has features of ARDS, so the practice started with the onset of the COVID pandemic in March 2020. So the next question is, how does proning help with oxygenation? So the larger part of the lung is on your back. So lying on your tummy allows it to expand more, as if you're taking bigger breaths. So this promotes lung tissue and lung oxygenation, thus improving the person's overall oxygenation or oxygen levels. That's why it's been part of the care and treatment plan in the hospitals as well. So let me cite some evidence on how proning helped people in the past. A 2013 study by French doctors published in New England Journal of Medicine found that patients suffering from ARDS had a lower risk of death if proning was used early on. Also in the US, a COVID patient at Long Island Jewish Hospital managed to avoid life support after proning. And in the UK, a 50-year-old woman with COVID-19 pneumonia made a remarkable recovery after the medics turned her onto her belly. Although proning promotes oxygenation in people who have COVID-19, not all people can do it. Here are some contraindications. The following are the contraindications for proning: respiratory distress, immediate need for intubation, low blood pressure, arrhythmia or abnormality in the heart rhythm, unstable spine, thoracic or chest injury, recent abdominal surgery, for example, you've had a bowel surgery, facial injury, neurological or brain issues such as seizures, agitation, morbid obesity, pregnancy, specifically the second and third trimesters, and pressure sores or ulcers. So someone asked, how long should someone do this proning, or how long should someone lie on his tummy? While the optimal duration hasn't been identified, it's been suggested by a meta-analysis that proning for up to 12 hours had reduced the number of deaths. In the intensive care unit, intubated COVID patients are being proned for 16 hours to be followed by an 8-hour rest. But for awake patients like you should be proning and changing your position every half an hour to 2 hours. So the last question by someone is, how do I prone? So if you're able to, you may try this position changes or time position changes. This is as per the Intensive Care Society Guidance for Prone Positioning of the Conscious or Awake COVID Patient 2020. Okay, so you may prone or lie on your belly for half an hour to 2 hours, and then lie on your right side for half an hour to 2 hours, and then sit up for 30 minutes to 2 hours, and then lie on your left side for half an hour to 2 hours, and then go back to prone or lie on your belly again for 30 minutes to 2 hours, and repeat the cycle. So this is for you to visualize what we're talking about regarding time position changes. So number 1, you're in prone for half an hour to 2 hours. Number 2, you're lying on your right side for half an hour to 2 hours. And then number 3, you're gonna sit up for half an hour to 2 hours. And then number 4, you're gonna lie on your left side for half an hour to 2 hours. And then finally, you're going back to your prone position. My reference here is the Countess of Chester NHS Foundation Trust. So guys, this ends our video on proning. If you like this video, don't forget to like it, subscribe to the channel for more videos, comment and share to your family and friends. If you've had experience on proning, don't hesitate to comment down below. Again, thank you very much for watching and stay safe. Bye!